us and how we have to handle our adolescents from now on. So we will be seeing mental health in adolescence, the disease burden, the issue as such, neurobiology, factors responsible for mental health disease, prevention, approach to a case with mental health disorder, and case presentation. If you see this study by Nimmans and also published in Lancet, two studies, where the numbers are so high, 9.8 million teenagers, 13 to 17 years suffer from depression, other mental disorders, who need active intervention. And without saying, we all know suicide ranks first in the cause of death among adolescents and young adults. And 30% of the world's suicide is in the area, India and China, where the young people are involved. And the onset, by 14 years, 50% of the adolescents have mental disorders, and it is our responsibility to diagnose early. And the average suicide rate is 10.9 among lakh of population. If you see the other all the mental health diseases like schizophrenia, depression, dysthymia, bipolar, panic disorder, generalized anxiety disorder, and so many other, OCD, everything, only 50% of the disorders are diagnosed, and other 50% need active intervention also. Apart from this, we have internet addiction disorder, which has not come under this study, and alcohol abuse, which most of them are not under treatment, smoking and alcohol. And apart from this, again, the special children who are having mental health issues, that is really uncared for. So the pediatricians have a great responsibility, especially the people who are trained in adolescent medicine. What is so unique about this area? Like everybody who so far who have heard, we all know there is so much of developmental changes that is taking place, both physically, mentally, and psychosocially. We have different phases, early, middle, and late adolescence, even moving on to the later phase of young adults. And there is a maturing brain, which is really complex, and only now, only in the 1990s, and also after the invention of functional MRI, we are able to understand the brain, where a lot of pruning is taking place. You saw the brain pictures where the gray matter is pruned and fresh nerve connections are being done in Dr. Chandal's slide presentation. And also the development, the physical, mental development, and what is happening around. It is asynchronous. Physically, the adolescent may be grown up, but mentally he is not mature enough for that amount of physical growth. Again, he or she is not that much mature enough to deal with what is the demands of the society or the psychological issues. They have to wait. Along with that, we have the academic demands, which is unique, and this is of the century, where we are putting extreme pressure on the kids to really perform well. And the peer pressure, global phenomenon. All the children want to mimic each other and to recognize themselves along with the other adolescents. And relationship with parents is becoming very tough. It had been always so, but it is even more tough with the pressures. And this is something we need to think, we should be aware of, that there is a second window of opportunity. There is, at one end, there is a rapid learning process, brain development taking place, pruning is taking place. At the same time, the brain is also vulnerable, which we must protect the brain from the bad effects. And what is this another chance? Not only on nutrition and growth, it is also for the pediatrician to recognize early and manage mental health diseases according to one's training. What is the role of primary care pediatrician? We must understand that we are family centric, and family has a powerful influence over the growth and development of the adolescent. As well as the parents have more responsibility towards the adolescent care. As ma'am said, they have to do role modeling. So every opportunity, the primary care physician, pediatrician must emphasize on this role. And why we have to take it upon ourselves is, you can see the 0.3% of psychiatrists and psychologists are available for 1 lakh population. And every year, the amount of mental health disease is becoming a bigger burden. The numbers are increasing statistically. And adult psychiatrists, they tend more to the adults predominantly. And to commemorate their for raising awareness and mobilizing support, we have October 10th as the Mental Health Day. Our role is to do early detection, screening, and management of optimum to our training. And they must treat the mental health diseases, what can be done at the primary level, and refer to other specialty. It's a teamwork. It is not that the pediatrician and adolescent physician work solo. We have to work along with the psychiatrist, psychologist, and social worker and counselors and other speech therapists, etc. The various systems, we only know about the noradrenergic, adrenergic system. We always, right from our medicine time, we had been taught about fight or flight. But only in the 1950s, 60s, and 1947, around that time only, we started understanding or discovering about the serotonergic and dopaminergic system, along with the cholinergic, GABA, opioid, and glutamate system. See, it is not only stimulatory, we have to understand it is also inhibitory. There must be a balance between both the systems, which is stimulating as well as inhibitory. And why adolescence is a time of true wonder. In Tamil, they say Vasanta Kalam, and most of them will have beautiful memories of adolescence. During this period, there is a lot of maturing brain, and there is high potential for intelligence, emotional intelligence, as well as the other kind of multiple intelligence. But what is happening is the brain is not maturing uniformly. The limbic system, which is primitive and which is the older part of the brain, matures first. And that is really the part responsible for the emotions, like the amygdala and caudate nucleus, etc. The myelination which is taking place is from the occipital towards the parietal and the frontal and the prefrontal areas. Again, the neocortex is getting myelinated or maturing later. And whatever had been learned in the childhood, which was not used, is going to be pruned, and fresh networking is going to take place. And every one of us must have this in mind. And I also tell the parents and the adolescents, this is the greatest opportunity to improve their mental faculties. There is new network connections along the various neuronal pathways, and the most important, the reward seeking, the happiness hormones, the why risk-taking behavior is so much in the adolescence. The happiness, the reward that gives him pleasure, pleasure-seeking behavior, that we must be aware of and gently divert from the high-risk behavior to the other behaviors, what Swati ma'am had told. Potential for high skill building. Yeah, this high-risk behavior must really be converted to high skill building. And the coordination, we must understand that must be graded, where we have this networking to the, even to the cerebellum, which is very important for the body coordination. We should not, that is exactly why we should not, the licensing of the two-wheelers, we have 18 as a cutoff. All this we must keep in mind and educate the adolescents. Why we are asking them not to indulge in those behaviors, and why we are delaying them to drive a bike. Unless we tell them, they just think we inhibit their independence. And the neuroplasticity is double-edged sword that will go towards the where we want to, like positive or negative. It is very plastic. If you pull into the negative, then there is more networking going towards the negative things we are going to put into our brain. So it is a double-edged sword, and human brain has always evolved for survival. This is part of the limbic system, the basal ganglia, the thalamus, the amygdala, the hypothalamus, and hippocampus. Each area has its own importance, like memory, thalamus for sleep and consciousness and alertness, which is very important, fight and flight. And amygdala, it's important for emotional response, very sensitive. And that is why we can see the mood fluctuation, the exaggerated emotional feelings of the adolescents, and which when it is losing balance, that is when the mental health issues crop up. And the hypothalamus, which controls everything. The hippocampus is important for memory. We must understand it has a lot of connections with the prefrontal cortex as well as the other areas of emotions. To highlight a little how much we have memories of the Mumbai blast and the Taj burning, and what kind of emotion it invoked in us. We correlate that emotion with the burning of the Taj. So memory is very important. The good memories, good feelings, and it connects to the prefrontal cortex and the higher end center, executive functioning. It will really aid the adolescents. Okay. What is the causation for the mental health problem? Just to highlight a few, all of us know about the genetic inheritance. Every one of us must be having some mental health gene hidden in our genetics. But we must also be aware of the epigenetics. That is, through generation, if you are going to promote the negative, like any depression or anxiety problems, promote the mental inclination to these mental involvement in our system, then it can affect a future generation. Like, for instance, if the mother is going to be very anxious, there are studies saying that the child also tend to be anxious. And the psychosocial factors are many, like maternal deprivation, pathological family patterns, which is very much which we must get into the details and can help in some of the preventive factors. And disordered interpersonal relationship, very very important, where we have to work on the life skills of the adolescents. Key stresses of modern in life, we have to be grounded. Like during COVID situation, we saw how so many positive effects were also there, along with the negative impact of the COVID on the health system. There were so many modern on the modern life, where the families were together, cooking together, learning new skills. All these things can be avoided. Same thing can be projected to a deserving adolescent. And new studies are coming on gut microbiome neural connection. There are a lot of serotonin receptors in our gut. So this also we must be aware in educating our adolescents and the parents on healthy eating behaviors, how all our food, the fruits and vegetables, the fibers, all these will play a greater role rather than the junk foods. And fetal origin, all along we had been talking about Barker and low birth weight and cardiovascular disease. There is some insult to the brain and also stressors which can affect the fetal brain and later can result in these mental disorders. So how to involve the parents as well as the adolescent? What can we do as primary care pediatricians and physicians to tell to adolescents and prevent us to do some preventive aspect in mental health? Connect with people. A man is a social animal, not to forget that. Always to be in the amidst people, friends, and talk with them. It gives lot of self-esteem and recognition to belonging. You belong to the people. And also sometimes it helps in sharing of emotions and sharing of distress, and they can give us some support. It is very important. And also physically being active, the dopamine that is going to be pumped whenever one is physically active. Not necessarily they should be in a gym doing. They can do other normal active instead of, I have seen adolescents not doing anything at home but daily going to gym. So we must integrate these kind of physical activity in a routine life. And also the other kind of, which will be very happy, which can give happiness, like getting engaged in a game. Like if they are interested in a throw ball or a volleyball game or something, or swimming, something new. And eating healthily. Time with the family is very much compromised. We know the internet has taken over and screen time has really, really taken over. Not only adolescents, I think every one of us who is watching this program today. That is very important. At least some dinner time can be together, or some whichever time is suitable for the family. And also the communication, actively listening to the adolescent can give us clues to pick up any mental health problems or sharing of the difficulties. So these things must be emphasized, which enhances positive mental health. Learning new skills, we should not restrict the children. I see very academically oriented kids, some of the parents, they don't let them do learning other new skills. That must be encouraged. Act of kindness, volunteering for charity work, or any other general work in the community, there is a lot of thanking and gratitude from other people will really boost the self-esteem and give some amount of pride in doing those activities, and inversely and automatically help in mental health and mindfulness. We must be grounded and really oriented to what the present, what we are doing, rather than worry about the past or worry about what had happened already. And in positive mental health, there were so many studies and which were done. They found the most important, which had really made a change in mental health disorders, was interpersonal, improving interpersonal skills, emotional regulation, alcohol and drug education. So every time we must, in schools and even while talking to parents or individually to in adolescent, we should be concentrating in these areas like emotional regulation, like for example anger control, or interpersonal relationship, how to communicate, how to talk and how to express the feelings. These can be done. And these are the some of the pathways, happiness and how mesocortical pathway. It is the two brains, the thinking brain and the emotional brain. There are pathways getting connected. We must wait for the maturation of the prefrontal cortex. What are the mental health disease or common mental health disease? There's so many. It is very difficult to speak about all these things in 15 minutes, but we must be aware all these diseases are there which are neglected. And the recent ones, like Dr. Mona said, eating disorder, very, very important. They are seeing a lot of cases. Internet addiction disorder, very important. There are so many classification. DSM-5 has included the classification, how, and we have screening charts how to diagnose, and substance abuse is rampant. So how do we approach a case of mental health problem? General medical checkup we have to do. That is a must, and that doesn't mean adolescent we do something else. We have to do a general medical checkup, and other organic diseases can present as mental diseases like hypothyroidism, Wilson's disease, or any other drug induced problems can be there. Heads is a must for which is a psychosocial review. It needs around 30 to 40 minutes. It gives entire history taking, and you can pick up very nicely the problem areas. Then we screen for the risk behavior and assessment, management at the primary level, what the pediatrician is trained up to, and then referral. When you think these are cases that must be referred, we must refer. So how do we go about this? So a good heads review, it will pick up all the red flag signs as early as possible. Like what is heads? Home environment. What is happening at home? Is it a nuclear family or a joint family? Who are there? Or is it a single parent, or the child is living, the adolescent is living in a hostel? That gives an idea how next we have to put our questions or what to expect if the child has a single parent. Next is the education and the employment. We should not take these for granted. The child, if we see an adolescent in our setup, definitely they must be going to college or school. Eating is very important. We must take a lot of thing, and activity what the adolescent is doing as a pastime or a hobby. So we should make a note. Never forget to ask about drugs. Gently the question must be put, like, is any of your friend, any of your friend who's smoking or into alcohol? And then you can lead the questions to in-depth questioning if you have a suspicion on that, or if you think it is necessary for that adolescent. Sexuality, don't take anything for granted or don't hesitate. You must improve your comfort level, and then ask question, or you can have a questionnaire. And we must talk about girl relationship, boy relationship too, because keep that in mind always. Suicide and depression, we must ask for the moods, and also we must really be aware of what is the normal level of the mood. Is it okay? The adolescents are having mood fluctuation. Is it normal or abnormal? Correlate with other signs and symptoms of depression. Also ask for anxiety symptoms and other OCDs and internet screen time, etc. Safety. We must ask about safety, whether they wear seat belts, whether they wear helmets, and if you feel it, they drive during taking alcohol, or if they go in the car driven by a friend who is under the influence of alcohol, you have to do the other screening tests like that. Spirituality must be integrated. They helps a lot in our further guidance, and that must be part of life. Doesn't mean it's something pertaining to any particular religion. So after doing a head screening, if there is no risk, or if you think everything is fine and smooth, this is the right time to do anticipatory guidance, because the adolescent is with you. Then if you pick up any risk factors, then you have to do the screening according to the signs picked up. You also have the strengths and weaknesses assessed, so you can use these strengths and weaknesses during the counseling session, that you can say, see, you are so you have so much of interest in sports. Why don't you do that? Why don't you join yourself in any sports academy, things like that? Or drawing skill, do some art classes and engage yourself, right? Counseling must be part of every pediatrician and adolescent health consultants. And I know most of us are good at it, because all along we had been doing this, and just that a little different with the adolescents. We must always, there are some skills told by Dr. Chandal, yes, we have to have all the attributes of a good counselor. And when it is not under our purview, then we have to refer the cases. Screening of mental health disorder, plenty of screening, which is standardized for Indians setup. We have many screening inventories, like Beck's depression inventory, suicide ideation questionnaire, SCARET for anxiety disorder. Then you have new ADHD rating scale, internet addiction disorder, craft, teenage addiction, severity index. So many, each thing. Even for bipolar, you have self-assessment screening tools. So many things are there, we need to read up. 100% we must refer immediately whenever an adolescent has suicidal ideation. Don't think we can handle this adolescent, we'll try to counsel. We might be in surprise if suddenly we hear the news of the death of the adolescent. All psychosis must be referred. Severe mental diseases, severe substance abuse, and if they are not poor response to counseling, must be immediately referred to the specialty. So with all this in mind, in your routine practices, if we see, there'll be a different kind of presentation. See, I saw this 15-year-old Radha, who was brought by the mother with complaints of low mood for 2 weeks, loss of appetite, and reluctant to study. This mother was very worried, because previously this adolescent was very happy going to school and cheerful adolescent. On detailed history taking heads, and then there was nothing much to worry. There was just that the adolescent was in the middle adolescence and having an acne, and there was a single pimple that she was bothered, and always spending time in the mirror, and she was not happy about this, and being teased about her friends. So that really put her off, and counseling and giving her telling her this is a normal hormonal change, and then it can be treated, and other strategies was given to this adolescent. And there was nothing much, but you can make a note of it, and this is just a normal passing of the adolescent. We need not imagine immediately if is the adolescent having a body image problem. Again, another Ajay, 15 years old, with weight 40 kg and 150 centimeters height, was bought by their parents with low mood and refusal to going to school. Here on history taking, and what we were able to assess was that the sentence are okay for the adolescent, was in the middle adolescent. Just that he was fitting well, then he has to understand all his peers in the class were taller than him, and he was short, and he was bothered, and he was bullied in the school for that. So we have to tell him we have to take mid-parental height and assess the parents' height, and chart the height weight charts and be confident about the height velocity, and he has to tell him that peak height velocity is yet to happen, and then we have to giving some assurance come for after 3 months, and also how to tackle his bullying in this school, and that is he needs to wait for his growth, and if he has more trouble he can come and talk again. So the adolescent was happy and there was no episode again. So is this all for adolescent? What are the mental issues? So we will be seeing what are the mental health issues in detail by Dr. Preeti Galagali. And what I would impress upon the pediatrician to give to the parents, building resilience like this fort is very, very important in mental health. So what are all the skills, whatever is available, we must give to the parents as well as the adolescents wherever the opportunity arises. Parents must be a role model, and we have to give positive uh, everything positive, like unconditional love and appreciation, and we have to tell them about the happy hormones and positive